Good afternoon. Welcome everyone to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang,
Here, sorry, I swallowed.
Senator Nguyen, Senator Stone, Senator Titus, Chair Donate.
And I'm here, and please mark Senator Nguyen as excused. She's presenting in a different committee. Good afternoon, everyone. Today we have two bill hearings on AB 403 and AB 463. Just as a few housekeeping announcements, we ask that if you have comments today to keep them short within the 2-minute time frame. If you wish to testify, you can please sign in and give your contact information to our committee managers, and anyone who wishes to receive copies of the committee's exhibits may go to the Nevada Legislature's website. We'll begin today with Assembly Bill 403, so I'll go ahead and open the hearing on this bill. This bill revises provisions governing halfway houses for persons recovering from alcohol and other substance abuse disorders. And so, if the bill presenters are here.
Hi, good afternoon.
There we go. All right, please
Dr.
begin.
Grant Sawyer. All right, thank you. Good afternoon, Mr. Chair and members of the committee. For the record, my name is Sean O'Donnell. I'm the Executive Director of Foundation for Recovery. AB 403 offers what I hope will be a pretty straightforward change in the licensing and certification of recovery homes in the state of Nevada. Recovery homes, formerly known as halfway houses, are safe, substance-free, and healthy residential environments where people recovering from substance use disorder are provided peer support, education, and learn skills vital for sustaining recovery in a home-like setting based on social model principles that have existed in the United States since at least the mid-1800s. Many recovery homes offer a congregate living environment where residents recovering from substance use disorder live together and share common space. They support one another during their recovery journey and reintegration into the community, such as finding and gaining employment, going back to school, attending support groups and meetings with one another, cooking meals together, and sharing common chores and tasks around the house. While residents of recovery homes may be engaged in clinical treatment services, recovery homes do not provide clinical treatment to residents themselves and should not be confused with residential treatment programs. Existing law requires homes to be both licensed and certified through the Division of Public and Behavioral Health, NRS 449 requires recovery homes to be licensed as facilities for the dependent and otherwise follow laws and regulations governing these types of facilities. NRS 458 requires recovery homes to also be certified by the division. The duplication of oversight efforts through licensure in NRS 449 and certification in NRS 458 poses an unnecessary burden to recovery houses. In 20 years of licensure, the number of halfway houses has been limited to no more than 10 facilities statewide in all 20 years. 8 are currently licensed in the state of Nevada. AB 403 removes the requirement that recovery homes be licensed by the division while preserving the requirement that they be certified by the division. The National Association of Recovery Residences, also known as NAR, represents over 20 state affiliates of recovery housing operators and develops and maintains quality standards for recovery residencies. NAR recommends that states adopt a certification process similar to what we already have established here in the state of Nevada, but they say nothing about required licensure in addition to certification. Nevada wants to support every opportunity for sustainable housing options for those in recovery as Nevada abates the harm caused by the opioid epidemic, as well as the impact of alcohol and other substances, and meets the need for vulnerable populations. The existing certification under NRS 458 provides a level of expertise beyond just the physical premises under licensure. It also ensures that the elements of the programming happening in these homes is up to national best practices. In other words, certification offers something more than assurances that homes are safe and sanitary, but also how the housing operators implement services that support recovery, stable employment, and healthy lifestyle choices. AB 403 also continues to uphold local zoning laws that allow the community to define and enforce necessary standards for the residences of individuals in recovery. Certification would continue to require compliance with public safety measures such as fire and sanitation, and can address any concerns of neighborhood councils to their impact. Overall, AB 403 allows us to step in the right direction toward national best practices and alleviates undue burden on existing recovery homes in our state. It continues to ensure that the necessary checkpoints and oversight exist for recovery homes so they can provide safe, clean, and supportive living environments. Thank you for your time and consideration. I'm available for any questions, and we'll turn it back over to the chair.
Thank you so much. Any questions from committee members? Senator Titus.
Thank you for the presentation. Just to clarify a statement that you made, in these situations, they are not offering any treatment, and that's the difference, correct?
Through the chair, Senator Titus, you're accurate. Yep.
So the only professionals, what they might get there is perhaps some peer, you could turn off your mic when I'm speaking, maybe you want to get the echo? There you go. Thank you. So what may happen in these situations, which are good, it's more peer-to-peer support, more of a group home where you can share each other's ideas, but there's no person that comes in there, you don't hold any counseling there, nothing within the facility itself. Correct?
Yes, that is correct.
All right. Thank you. Thank you, Mr. Chair.
Thank you so much. Senator Stone.
Thank you, Mr. Chairman, and thank you for the presentation. Just a few questions. So are we basically just changing the name of a halfway house to a recovery house? And can you articulate the difference between a license and a certification?
Yeah, Senator Stone, thank you for that question. Yeah, so we are updating the terminology from halfway house to recovery home, which is less stigmatizing of a name, but essentially they are the exact same thing. And then in regards to the licensure and certification, licensure is really something that you purchase, and it requires, it really just oversees the safety of the actual facility, but not the delivery of any programming happening in the facility. Where certification is a voluntary process that a recovery home could go through to show that they are actually aligned with best practices, and the certifying entity evaluates the delivery of the programs that are happening within the house.
And if I could just follow up, are you suggesting that because we only have 8 of these facilities, that it's a function of whether we certify them or license them? And do you think that by certifying them that we're going to see more of these recovery homes? Because I would imagine we don't have enough in the state.
Yes, thank you for that question. Yeah, really at the end of it, this bill is about expanding recovery home options in the state of Nevada. And we work with many recovery housing operators, and doing both the licensure and the certification requirement is really just a burden on these operators.
Thank you.
Thank you so much. Any other questions? Seeing none, we'll go ahead and open it for support testimonies. So if you're here in support, please come forward. And we'll begin here. Dr. Cole, please
Good
begin.
afternoon, Chairman and committee members. Barry Cole, B-A-R-R-Y-C-O-L-E. I'm in support of anything that increases our access to mental health services, substance use treatment facilities, and I get it, this is not a treatment facility, but let me remind you that the original premise of AA was any 2 people got together and they could have a meeting spontaneously. I think you're going to find there'll be informal meetings with any 2 to 4 people residing together. The beauty of having sober friends, you tend to stay sober. You hang out with people that drink and use drugs, you tend to use drink and drugs. So this is a great move in the right direction. I urge support for AB 403. Thanks.
Hi, my name is Morgan Biaselli, here with Silver State Government Relations. I'm here representing Vitality Unlimited and New Frontier. They are both alcohol and drug treatment centers, and they support this bill. Thank you.
Thank you so much. Anyone else here in Carson City? Anyone in Las Vegas? And BPS, anyone virtually?
Chair, there are no callers at this time.
Thank you so much. Anyone in opposition? Please come forward. BPS, anyone virtually?
Chair, there are no callers in opposition at this time.
Thank you so much. And anyone in neutral, please come forward. Seeing none, BPS, is there anyone virtually?
Chair, there are no callers choosing to testify at this time.
Thank you so much. In the interest of time, I'll go ahead and close this hearing. Seeing that we have already gotten closer to the end of session, I will ask for a motion to do pass this bill from. And we got a motion from Senator Titus and a second from Senator Lang. Any discussion on the motion? All those in favor, please say aye. Aye. Any Opposition? Any abstentions? Motion carries, and I will go ahead and take that floor statement. Let's move on to Assembly Bill 463. I'll go ahead and open the bill hearing on this bill. This bill revises provisions governing childcare facilities and certain childcare programs, so please begin when you're ready.
Good afternoon, Chair Donate and Senators. My name is Carissa Loper-Machado. I'm the Agency Manager for the Division of Welfare and Supportive Services. Assembly Bill 463 is being brought by the Department of Health and Human Services to transfer certain duties and authorities related to child care licensing and regulation from the Division of Public and Behavioral Health to the Division of Welfare and Supportive Services. This is a companion policy bill to accompany the transfer of the child care licensing budget account from the Division of Public and Behavioral Health to the Division of Welfare and Supportive Services. These transfers will align budget authorities and the programmatic implementation and oversight for child care licensing activities under the Division of Welfare and Supportive Services, which is the lead agency for administering the federal Child Care and Development Block Grant. This change will create administrative efficiencies by having one agency be responsible for the oversight and implementation of child care licensing activities. The administrative transition will not impact service delivery or communications with child care providers. The transfer will be seamless to the child care providers. In summary, Sections 1 through 4, Sections 6 through 8, and Sections 11 and 12 make the necessary administrative changes in the Nevada Revised Statutes to transfer the authorities and duties of child care licensing and regulation to the administrator of the Division of Welfare and Supportive Services. Section 5 makes various changes to the membership categories of the Nevada Early Childhood Advisory Council to ensure proper representation from the appropriate Division of Welfare and Supportive Services staff and from Nevada's tribal community. The reprint before you addresses language discrepancies between the original text for AB 463 and AB 114, a similar bill which also makes additions and changes to the membership of the Nevada Early Childhood Advisory Council. So those languages have now been married, if you will, so that both bills are similar. Section 8 transfers the authority to enter facilities to conduct licensing inspections from the Chief Medical Officer of the Division of Public and Behavioral Health to the Administrator of Division of Welfare and Supportive Services. The Division of Welfare and Supportive Services Administrator will authorize and direct child care licensing staff to conduct such inspections following the current standards. Section 8 also makes changes to ensure efficiencies for individual licensed child care providers while maintaining high fire safety standards. After discussions with the state fire marshal following the initial bill hearing, Section 8 was amended to specify that a designee of the state fire marshal must meet an industry standard accepted by the state fire marshal. Section 8 additionally removes the statutory requirement that the state fire marshal must inspect a child care facility annually. Licensed facilities are also businesses, both large and small, and child care providers and facility owners must meet both local and state standards to be open for business, as well as the child care licensing standards. If this bill is approved, the Department of Health and Human Services will work closely with the State Fire Marshal's Office, local fire agencies, and local business licensing agencies, and child care providers and owners to develop a fire inspection schedule that ensures safety but also reduces duplicative visits to those individuals' facilities. Sections 9 and 10 clarify that immunization coverage reports for child care facilities should continue to be submitted to the Division of Public and Behavioral Health, where the immunization program still resides. Thank you for your time this afternoon. That is the summary of the bill, and I am here to answer any questions.
Thank you so much. We'll start with Senator Titus.
Thank you very much, Chair. Just a clarification, your comment, the reason this is being brought forward is under the fact that the federal funds lie in this other department, and you're trying to merge these two so you don't have two different agencies basically doing the same thing, trying to be more, my really favorite thing I like government to do is be more efficient.
Carissa Loper-Machado, for the record, Agency Manager, Division of Welfare and Supportive Services, through you, Chair, to Senator Titus. Yes, ma'am, that's exactly what we're doing. The Federal Child Care and Development Block Grant provides about 80% of the administrative funding for the child care licensing branch. We, the Division of Welfare and Supportive Services, end up transferring that funding over to Division of Public and Behavioral Health, so we are absolutely trying to improve efficiencies for the state and for those providers.
Thank you so much. Any other questions? All right, we'll go ahead and open it for testimony. If you are in support of this bill, please come forward.
Good afternoon, Mr. Chair and members of the committee. Leah Case here today on behalf of the Children's Advocacy Alliance. We supported the division's budget enhancement, budget process that made this change to move the departments. We also echo Senator Titus's comments about needing a more efficient government. It is really difficult to start a childcare business in this state, and anything we can do to make that easier on our childcare providers and make sure that there are enough providers of childcare in the state will get the economy going and make sure people can get back to work. Thank you so much.
Thank you so much. Anyone else here in Carson City? Seeing no one here or in Las Vegas, BPS, is there anyone virtually in support?
Chair, there are no callers at this time.
Thank you so much. Anyone in opposition, please come forward. BPS, is there anyone virtually?
Chair, there are no callers at this time.
Thank you so much. And last but not least, anyone here in neutral for this bill, please come forward. Seeing none, BPS, is there anyone virtually?
Thank you, Chair. There are no callers at this time.
Thank you so much. A little bit too quick. In the interest of time, I'll go ahead and close the hearing on this bill. We'll go ahead and I'll take a motion to do pass this bill. We got it from Senator Titus. Is there a second? Second from Senator Stone. Any discussion or questions? All those in favor, please say aye. Aye. Any opposition? Motion's carried, and I'll go ahead and take the floor statement for this bill. That concludes the bill hearings. Is there anyone here for public comment? Anyone in Las Vegas? And BPS, anyone virtually?
Chair, the public lines are open and working. However, there are no callers at this time.
Thank you so much. Before we conclude, I did want to express my gratitude to the committee members. This may be our last meeting of Senate HHS for this session. We don't know if there are going to be bills that are referred to us, so I wanted to extend my gratitude to all the senators that served on this committee, but most importantly to our committee staff, both Mary and Norma have been gracious to us throughout this entire process. They've been our committee secretaries who have documented all the fights we've had on this committee. Roberta, who has been graciously my legislative assistant and my committee manager. This is our second time doing it from this go around, and so she's been there for me every step of the way. We have Mr. Eric Robbins, who of course folks know as our committee legal counsel, who helped draft our amendments, and then Destiny Cooper, who is our policy analyst. We've had a great team with all of us, and we greatly appreciate folks for their advice. We've had hiccups, of course, throughout this entire session, but we hope that we can walk away with policy that helps our state, and we'll continue to work throughout the interim. We do have committee gifts, of course, for the committee folks and for our staff, and we thank everyone for joining us, and we look forward to continued conversations. Thank you so much, and meeting's adjourned.